Hello, how's everybody doing today? So in today's video, I want to go over some of the questions that I'm using to study. Some of these come from study guides. Some of these are similar to the actual quizzes I'm taking in my pathophysiology class, or similar to test questions that you'll get in pathophysiology. And they come from different study materials. I'm using some online. Some are textbooks that I have, and then some are like this flashcard set that I got. Anyway, so I had a lot of people ask me, how difficult are the questions? Is it similar to undergrad pathophysiology? Is it tougher? So I'll say it definitely is tougher, and you would want it to be, because you're in the graduate level. I don't think it's as tough as the questions you get in medical school. Some of them may be, but I also have some questions from a medical school textbook, some test questions from there that I'll read and go over. Try not to bore y'all to death just reading these. I wish I was good with the graphics where I could put that at the bottom, have the question at the bottom. Maybe one day I'll figure that out. Too busy though right now. Anyway, so jumping right in. So one of the first questions is, which of the following sets of laboratory findings is most likely seen in patients with sarcoidosis? And it gives you several answer choices between hypercalcemia, which is high calcium, decreased CD55 and CD59, increased ACTH, or increased alkaline phosphatase, or ALKP. So of those four choices, I would choose hypercalcemia, and I got that one right, thank goodness. And then when you do the question on this particular website, I'm not going to say the name just yet on this, just because I don't know if I'm supposed to be reading these off or whatnot. But for hypercalcemia, the reason that's associated with sarcoidosis, it'll give you a little description. It'll say due to vitamin D activation, calcium absorption is increased, and yada yada yada. But it has a pretty good little paragraph there on that. Let's see the next question. Which of the following findings is most likely seen in patients with sarcoidosis? Two sarcoidosis questions in a row, and that might be because I recently was trying to study up on sarcoidosis, but this one's kind of new, so I don't know the answer on this one. So let's see my choices. You got elevated ACE or ACE, increased amylase and lipase. You have increased alkaline phosphatase and a decrease of ACH. And the answer is elevated ACE. So it says sarcoidal granulomas produce ACE, and patients with this disease display elevated serum ACE levels. There you go. So that was one resource. Another one that I'm using, and it doesn't really have multiple choice. That's online. I actually found this one through Quizlet. I don't mind saying that one because everybody goes through Quizlet and finds different study banks and things like that. So like one of the questions is, angiotensin II increases the workload of the heart after a myocardial infarction by what mechanism? And the answer is increasing peripheral vascular resistance. And it'll give you an explanation as well on there. Let's do one more from here. Same type of questions. What medical term is used for a condition that results from pulmonary hypertension, creating chronic pressure overload in the right ventricle? And that is known as cor pulmonale. And cor pulmonale develops as pulmonary hypertension, creates chronic pressure overload in the right ventricle, which I guess would lead to right ventricular hypertrophy Anyway, so those are some of the questions. Those are very similar to quiz questions that I've had. They'll ask something like, that same exact question. What term is used for a condition that results from pulmonary hypertension? And you'll have multiple 4, 5, 6 answer choices. And when there's that many answer choices, it's hard to guess. Let's see, one more from that type of question. Which medication classification is generally included in the treatment of silicosis? And the answer for that is corticosteroids. It says no specific treatment exists for silicosis, although corticosteroids may produce some improvement in the early, more acute stages. So that's a couple of those questions. And then I also have these little flashcards, and these are more geared towards, the med school level. And this is more like a vignette, and it says a man comes to the office with persistent asthma, despite using bronchodilators. In addition to episodes of shortness of breath, he has sputum with brown mucus plugs, transient infiltrates on chest x-ray, and eosinophilia on CBC. There are tram track markings on chest x-ray. And then I'll ask you 3 questions here. What is the most likely diagnosis? And the answer to that would be allergic bronchopulmonary aspergillosis. I can never say that word. Aspergillosis. Yeah. So that's the answer for that one. And then ask, what is the most accurate diagnostic test for that? So you really have to know number 1 to be able to get to number 2. And number 2 is elevated level of IgE. So you'll test the IgE level. And what is the treatment? Treatment is with prednisone and itraconazole. Okay, there you have it. That one's going to be these type of questions will probably come up later on in my training. This isn't really pathophysiology geared. Sometimes I do these though just to kind of see if I can figure out from the pathophysiology standpoint. But some of the things about treatment and things like that we haven't gotten into is that deep anyway. A little bit. And then just a couple more questions. So this is from a medical school textbook study guide. And these are very long questions. I was trying to find shorter ones to not bore you since it's not up on the screen. But this just says that a study was conducted of patients who smoked cigarettes for 30 years. These individuals undergo pulmonary function testing, and a large subset are found to have decreased FEV1, normal to decreased FVC, and FEV1 FVC ratios less than 70%. Which of the following respiratory tract structures in the lungs is likely to be affected most by the underlying disease? And then it says alveolar duct, alveolar sac, bronchi, respiratory bronchial, or terminal bronchial. So the answer to that one would be the respiratory bronchial. And that is because one thing I do remember a little bit is the FEV1 to FVC ratio. When it's decreased below, some texts will say, I think 80%. This one says less than 70%. When that is decreased, it is an obstructive lung disease. You have restrictive lung diseases and obstructive. Anyway, and so that's how you're kind of able to tell which part of the lung and narrow it down to the answer, which is respiratory bronchial. Last question, because this video is getting kind of long and kind of boring, but just give everybody an idea, because I know a lot of people have asked this. So this one is a 70-year-old woman has episodes of dyspnea and wheezing and coughing, accompanied by urticaria for the past 3 years. I really need to learn how to pronounce some of these words a little better on the spot like this. She has had bouts of rhinitis. She has a 10-year history of osteoarthritis. On physical exam, she has nasal polyps. Use of which of the following medications is the most likely risk factor for her respiratory disease? Now, I know this is in the respiratory chapter. I failed to mention that. The answer choices are Tylenol, aspirin, gabapentin, morphine, or prednisone. And I know this is going to be, so when you hear nasal polyps, and then there's an association with a medication, I know aspirin has some kind of, there's a significant finding there with nasal polyps and aspirin. And then something to do with, in children, if children have nasal polyps, they have a higher chance of having cystic fibrosis, or there could be a chance that they have cystic fibrosis. I think in adults, it's a type of asthma that has to do with an allergy to aspirin. I think it's like an aspirin-induced asthma or something. Somebody correct me out there that knows better. I briefly read over this, and I'm going to, this is kind of the chapter I'm in right now, currently just kind of going over this a million times in a row, trying to get this stuff down. But anyway, so these last two were examples of more of a med school level, I guess you could say. But you want to try to learn it as in depth as you can. If you're going to NP school or PA school, and people say, "Oh, they're just a mid-level provider," I don't ever want to accept that. I want to try to learn as much as I can. Obviously without going to medical school. I know that would be the best advice and the best thing to do if I wanted to learn as much as I could. But right now, that's not feasible. So for me, it is to learn as much as I can in this program. So anyway, those are some of the examples. Later on in the week, I think, I'm going to do a little coronavirus update, because I think that's what everybody wants to hear about. People ask me all the time, and I'm like, whoa, I'm not an expert. I'm really just relaying what the CDC and the World Health Organization, even, what my professors and textbooks say, but, mostly, what the CDC recommends. Anyway, that's a whole different thing. I'm going to try to do another video on that, a part 2 corona virus update. But those are some of the questions. Please subscribe to the channel. Ask me questions. I love when people send me Facebook comments or private messages, or just in person. A lot of my friends that have seen the channel have asked me, different questions like, "Hey, what are the tests like? I don't know if I can do it." And I'm like, listen, if I can do it, anybody can do it. But anyway, y'all have a great day. Stay healthy out there.